Not only is MAHA eugenics, but it's also a sham. Watch this.
Being obese is a problem. Obesity by itself, Peter, drives probably a quarter of all healthcare expenses. So if you really want to drop the cost of healthcare in America, get healthier. By the way, your green room, this is non-MAHA, all these snacks. This is all they have back there.
Oh no.
This and water. But getting people to eat better and exercise, which is Secretary Kennedy's primary mission. The reason he took the job was to get MAHA into the agenda for the American people. Works.
He said if you want to drop the cost of healthcare in America, then get healthier. That's like saying if you don't want to die of cancer, just don't get cancer. It's obviously completely absurd. And this is completely in alignment with the ideas behind MAHA that falsely give people the sense that we can fully control our health. And unfortunately, that's just not the case. Yes, there are things we can do, for example, exercise or eating healthier, that can help us be more healthy. And there are things that we can do, for example, smoking and drinking alcohol, that can make us less healthy. But that doesn't mean we have control over every aspect of our health. The reason wellness influencers are so successful at selling us what I call the illusion of control is that, of course, it's scary to understand that we don't really have control over everything. And it is much less scary to believe that we can, for example, use coffee enemas to cure our cancer. But that isn't actually true. And giving us that illusion of control when we don't have it is actually quite harmful. That's why we see people like Paloma Shamirani refusing appropriate medical treatment and then dying as a consequence. Another problem with this framing is this idea that if you do have any health problems, then it's your own fault. And if you have any health problems, then you're lesser of a person because you weren't able to manage your own health. And that's part of the eugenics of it. The other part of this I wanted to talk about is when he says that talking about diet and exercise is somehow like a new idea. Physicians have been talking to patients about diet and exercise basically forever. I used to practice bariatric surgery and I'm still board certified in general surgery and in obesity medicine. And I can tell you for sure that discussing diet and exercise is always a part of these conversations. As a patient myself, I'm 45 and relatively healthy, but still every time I see my regular doctor, she asks me about my diet and my exercise. Trying to put a new label on something physicians have been doing for ages is not only a sham, but it also creates mistrust between patients and physicians, which is actually going to lead to worse health outcomes.